People are now exposed to so many viruses. It's really hard to know if you have COVID, the flu, or RSV. News 12 Connecticut's Mark Sudol hears from a local doctor and what daycares are now seeing.
You've never all had to lay down.
Doctors say we are now in one of the highest levels of respiratory viruses we have seen in a long time.
It's the pediatric emergency rooms and the pediatric hospitals that are being very hard hit.
Dr. Joanne Passalacqua, an infectious disease specialist at St. Vincent's Medical Center, says symptoms of RSV, the flu, and COVID can seem similar. So the best way to tell them apart is to
go to your urgent care, your emergency room. They have screening tests that can distinguish between the three illnesses.
There is currently no vaccine for RSV, but Dr. Passalacqua says shots of COVID and the flu are so important now because many people have had very little natural exposure to viruses since the pandemic.
Our natural immunity that we would ordinarily carry toward viruses like RSV and influenza have waned significantly over the last 2 years.
They tried to intubate her 7 times. And then they had to do CPR for 4.5 minutes.
Children across the country are seeing an increase in respiratory illnesses.
Elderly and young babies, RSV can be a devastating pneumonia.
But Alina Gutierrez at Three Little Bears Daycare says so far she hasn't seen any cases of RSV.
We have had the flu, COVID, where staff has had to quarantine.
Gutierrez says she is vigilant about following the CDC and state guidelines.
We just sanitize our hands, wash our hands after taking care of the children, feeding them.
Doctors advise to be extra careful around friends and family this holiday season. In Bridgeport, Mark Sudol, News 12 Connecticut.
And for more information on RSV, we have a link at news12.com.